Chapter 20, Blood Vessels, Part 2. So, we're now going to talk about the circulatory routes. This is the series of vessels, that's arteries, arterioles, capillaries, venules, and veins, the blood passes through as it travels throughout the body. First up is coronary circulation, which we had talked about when we talked about the heart in Chapter 19. And what it does is it is a series of arteries that are bringing blood to the heart itself and nutrients to the heart, oxygen and nutrients to keep the heart alive, and then the veins that carry it back to the right atrium. Pulmonary circulation, as we know, is the blood vessels that are carrying deoxygenated blood from the right side of the heart to the lungs, where the blood then becomes oxygenated, and then the vessels, the pulmonary veins that carry that oxygenated blood to the left side of the heart. So again, deoxygenated blood coming from the right side through the pulmonary trunk and pulmonary arteries, go to the lungs, become oxygenated, and then the oxygenated blood travels by pulmonary veins back to the left atrium of the heart. So we are going to go through a series of arteries and veins. You need to know their names, where they are, the direction that blood flows through them. So if I gave you like 3 blood vessels in a row, you could put them in the correct order as blood flows. Also worth noting that in the human body, there are actually more veins than arteries. So don't let that confuse you. So here is the heart. Coming directly off the heart from the left ventricle is the aorta. At the top of the aorta, it curves, referred to as the aortic arch, and then it turns 180 degrees down and becomes a thoracic aorta that travels through the thoracic cavity to the abdominal cavity. So again, aorta has the aortic arch on top where it's curving around 180 degrees and then becoming the thoracic aorta that'll travel through the thoracic cavity down to the abdominal cavity. Coming off the top of the arch of the aorta is 3 arteries, the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. So remember them in that order from right to left: brachiocephalic trunk, left common carotid artery, left subclavian artery. The brachiocephalic trunk will split into the right subclavian artery and the right common carotid artery, so that eventually we do have a right common carotid artery and a left common carotid artery. These are carrying blood to the head, and we have a right subclavian artery and a left subclavian artery. These are carrying blood to the upper limbs. And which direction does blood flow? It's flowing away from the heart. Arteries always carry blood away from the heart. The common carotid arteries will split into the occipital artery going to the back of the head, the temporal artery on the lateral or side of the head, and the facial artery to the front of the head. Again, blood traveling to the head from the common carotid artery to either occipital, temporal, or facial arteries. The subclavian artery leads to the arm. It turns into the axillary artery around the armpit area, and then turns into the brachial artery in the upper arm area. Again, we don't have any major branching. This is just changing names when it changes location. So like sometimes you can be driving on a street and a road's name will change even though you didn't turn anywhere. So subclavian artery becomes axillary artery, becomes brachial artery. This will then split into the radial artery, which runs along the lateral side of the forearm, same place the radius is, and then the ulnar artery on the medial side of the forearm, same place as the ulna is. So axillary, brachial, radial, or ulnar. The thoracic aorta will eventually become the abdominal aorta when it enters the abdominal cavity. So the large vessel here is the abdominal aorta. Branching off the abdominal aorta, we have the hepatic artery, that should say artery, hepatic artery. The hepatic artery going to the liver, the splenic artery going to the spleen, the renal arteries going to the right or left kidneys. So again, hepatic artery to the liver, splenic artery to the spleen, renal arteries right or left to the kidneys. At the inferior end of the abdominal aorta, it will split into the common iliac arteries. The common iliac arteries will then carry blood to the legs, and the blood will enter the femoral artery, which travels all the way down to the bottom of the foot. Branching off the femoral artery is the deep femoral artery. So it goes common iliac artery, which then branches into the deep femoral artery and the femoral artery. All right, that was the arteries. Now we'll talk about the veins. So the two large veins carrying blood to the right atrium are the superior vena cava and the inferior vena cava. The superior vena cava is formed from the merging of the right and left brachiocephalic veins. So right and left brachiocephalic veins fuse to form superior vena cava, which then carries blood to the right atrium. The brachiocephalic veins, on the other hand, are formed from the internal jugular vein and the subclavian vein. So here is the right brachiocephalic vein. Here is the right internal jugular vein. It would be the right subclavian vein. And the internal jugular vein is carrying blood draining from the head. The subclavian vein obviously is receiving blood from the arm, so it goes right, in this case, right or left, axillary vein, which then becomes the right subclavian vein, which then, etc., etc. In the inferior vena cava, it travels down into the abdominal cavity. So this is all inferior vena cava, in the abdominal cavity and part of the thoracic cavity. Blood is carried to the inferior vena cava from the hepatic vein coming from the liver. Blood is also carried from the splenic vein coming from the spleen, and the right and left renal veins carrying blood from the kidneys. So again, blood will come from the liver via the hepatic vein, the spleen via the splenic vein, and the kidneys via the right or left renal veins. At the inferior end of the inferior vena cava, it has it split into the common iliac veins. So right and left common iliac veins carrying blood from the legs. Common iliac veins receive blood from the femoral vein and the great saphenous vein. So right and left, we have the femoral veins and great saphenous veins carrying blood from the legs. They then empty into the common iliac veins that then empty into the inferior vena cava, which then carries the blood to the heart. Hypertension. Hypertension is chronic high blood pressure. This is when someone's blood pressure is usually above 120/80, either one or both of those numbers being chronically above 120/80. So 130/80 would be hypertension. 120/100 would be hypertension, and of course 150/100 would be hypertension. So one or both of those numbers. Things that can cause hypertension: obstruction to renal blood flow. That's obstruction to blood flow in or to the kidneys. Kidneys are very important in maintaining the proper composition of blood. So anything affecting them can affect overall blood conditions. Also could be hypersecretion of aldosterone, so too much of this hormone being produced, leading to an increase in blood volume. Blood volume increases, then blood pressure would increase. It could also be caused by hypersecretion of epinephrine, or commonly known as adrenaline. Hypersecretion of epinephrine, too much epinephrine being produced, would cause the heart to beat faster, to beat harder than it needs to. And the heart is working harder, it decreases the blood pressure. And of course, another cause could be diet. A very healthy diet leading to blood vessels being too occluded with fatty deposits. Could be a high salt blood diet. If you eat too much salt, it can cause your blood pressure to increase significantly. So these are possible causes of hypertension, chronic high blood pressure. Now, in any given day, there are certain periods in that day where your blood pressure can be above 120/80. Like say you're exercising, your blood pressure is going to be higher then. That is just temporary and it's perfectly fine. So, consequences of hypertension. There are a lot of adverse effects from high blood pressure. You could get a stroke. You could have blood vessels, arteries in the brain burst, causing a hypertensive stroke in the brain. You could have retinal damage. The arteries in the retina might burst, causing you to lose vision in one eye or more. High blood pressure also causes strain on the arteries, leading to some slight minor tearing in the arteries that could allow for atherosclerotic plaque formation, fatty plaques forming in the arteries, causing them to have less space within, leading to more problems possibly. You could have ventricular hypertrophy. The heart could be working too hard, and so it gets too thick for muscle tissue expanding, thereby decreasing the amount of blood the heart can hold, which then causes it to have to beat even harder. Horrible, terrible loop there. Kidney failure, the important blood vessels in the kidney could rupture, leading to kidney failure. And then finally, an aneurysm could develop. Aneurysms are where an artery has expanded and widened, but it can't shrink back down. So it's basically slightly damaged so that it's too wide. Because it's slightly damaged, it makes it very weak, leading it to possibly bursting later, which could be a major problem depending on which artery it is. All right, and that is it for this lecture.